Welcome to the course Food Safety in Temporary Food Establishments, Part 1, presented by the Environmental Health Division of the 1st District Health Unit. This is Part 1 of the food education course that is only valid for those employees that work in temporary food establishments. If you work in any other food establishment, you will need to view the 9 parts of the 1st District Health Unit Food Safety for Food Service Employees course. As you are watching this course, take notes. At the end of each part, you will be given a test code. You need to write these down in your notes. Once you have watched all 4 parts, contact a 1st District Health Unit office to schedule your test. When you go to take your test, you will need to bring your notes, the 4-part test code, a valid photo identification, and the test fee with you in order to be eligible to take the test. According to the Centers for Disease Control, there are approximately 48 million cases of foodborne illness per year in the United States, or about 1 out of 6 Americans getting a foodborne illness. More than 128,000 people end up hospitalized each year because of foodborne illnesses, and there are approximately 3,000 deaths each year that are caused by foodborne illnesses. A foodborne illness is any illness that is associated with or in which any causative agent is obtained by the ingestion of food. So if you eat something and it makes you sick, you have a foodborne illness. A foodborne illness outbreak is what occurs when an incidence of foodborne illness involves 2 or more people who eat a common food. What you have to keep in mind is that the food employees have more to do with whether the people eating the food from a food establishment will get a foodborne illness or not than any other factor. There are lots of different things that cause foodborne illness, and they can be divided into 3 categories: physical agents, chemical agents, or biological agents. Physical agents are actual objects that get into the food and include things like Band-Aids, glass, artificial fingernails, or hair. Chemical agents are things that are dissolved into the food in such a way so that you can't see them. They include things like medicines, which include personal medications, or poisons, which includes things like cleaners and sanitizers. Biological agents are living organisms that cause disease and include things such as bacteria or viruses. You cannot see, smell, or taste bacteria or viruses. Bacteria are very small. They can only be seen with a microscope. Viruses are even smaller. The bacteria that cause disease are not the same as the ones that cause food spoilage. What this means is that the bacteria that cause foodborne illness may be present on the food, and there's no way to know. You can't see them, smell them, or taste them. In a food establishment, there are certain places where you are likely to find bacteria. You are likely to find bacteria on raw meat and in raw egg products. Salmonella is associated with poultry, and raw poultry has high levels of salmonella contamination. E. coli is associated with beef, especially beef that has been ground into hamburger. You may also find bacteria on the bare hands of food handlers. There's a type of bacteria called Shigella, which is associated with human fecal material and can be found on the hands of people that are ill with Shigella. You can also find bacteria in foods that have been cooked to kill bacteria in the form of spores. Sick food workers handling food equals the people that eat that food getting sick. Bacteria and viruses spread through the fecal-oral route can cause foodborne illnesses. In the fecal-oral route, you have a person that is infected with a foodborne illness. This person uses the restroom. Their hands become contaminated with fecal material that contains the pathogens that cause the illness. They work with food, contaminating it with the fecal material and pathogens from their hands in the process. A person then eats that food along with the fecal material and the pathogens that are in it, and they get sick. Each food establishment must have an employee health policy. At a minimum, it has to include the following items. If a food worker is diagnosed by a medical professional with certain illnesses, they cannot be in the food establishment or work with food. Those illnesses include E. coli, Salmonella, Shigella, hepatitis A, and norovirus. Also, if a food worker has any of the following symptoms, they can't be in the food establishment and they can't work with food. Those symptoms are diarrhea, vomiting, jaundice, or a sore throat accompanied by a fever. Also, if a food employee has wounds on the hands or arms, they must put a bandage over the wound and then wear a glove over the bandage if that wound is on the hand. If the wound is on the arm, they have to put a bandage over the wound. According to the FDA, poor personal hygiene contributes to about 50% of the foodborne illness outbreaks that occur. To prevent foodborne illness caused by poor personal hygiene, it is critical to use the correct hand washing procedure. The entire hand washing procedure used by food employees has to take at least 20 seconds. Use warm water and lots of soap. Scrub the fingertips, including the area around and under the fingernails, the areas between the fingers, the backs of the hands, the wrists, and all exposed portions of the arms for at least 10 to 15 seconds. Rinse off all soap with clean water and then immediately dry the hands using a single-use towel. You want to wash your hands after you touch any bare human body part that is not your cleaned hands. After using the restroom, after coughing, sneezing, using a handkerchief or tissue, after using tobacco or eating or drinking anything, after handling soiled equipment or utensils, after caring for or handling service animals or other aquatic animals used as food in the establishment, or after any other activity that contaminates the hands. Also, you want to wash your hands before you put your gloves on to begin working with food. Hand washing for food employees may only take place in an approved hand washing facility, and that hand washing facility may be used only for washing hands and for no other purpose. In a temporary establishment, you may use a temporary hand wash station with a source for warm water, a tub to catch the rinse water, soap, and paper towels. Hand sanitizers do not take the place of hand washing. You can only use hand sanitizers if you place them on hands that have already been washed and if they're labeled for use in a food establishment. It is important to keep your hands and all exposed portions of your arms clean. You want to keep your fingernails trimmed, short, and in good condition. They should be smooth and cleanable. When you're working with exposed food, you may not wear fingernail polish or artificial fingernails, and you may not wear any jewelry on your hands or arms. This is the end of Part 1. Your test code for Part 1 is 04.